right, good morning / afternoon, everybody. My name is Dana Mitchell, and I'm an account manager with Mountain Pacific, and I support the nursing homes in Alaska and Hawaii. And I feel like I drew the jackpot on those two. We're very glad that you're here today. We're going to talk a little bit about vaccine statistics and some successes that we've seen with COVID vaccines. So do you want to go ahead and get that started, Mary? Great. So I understand. Next slide, please. As always, we really want to hear from you about what topics you want us to cover. Your ideas or needs, please enter those into chat or email your closest connection to Mountain Pacific so we can make sure we roll those in. We are continuing every Wednesday until the end of the year, so we'll have lots of time to touch on issues that are keeping you up at night. Next slide.
We're going to do the polls here.
We got a poll coming up. Great. All right. So we've got a poll for today, and we're just asking if you will indicate what your approach is to administering vaccines. One is that your partnering pharmacy is providing it and you administer it. Do you have a visiting provider come? Does your health department come in? Are you kind of using everybody, whatever resources you can get a hold of? Or are you an approved provider and order and provide your own vaccine? Or if you have some other approach, we would love to hear that too. So we'll leave that up for, how long do we leave it up, Mary?
Just give it a minute more, I guess. We have 11 of 35 right now.
All right. All right. Give you just a few more seconds. All right, it looks like the bulk are your own provider, which is great, and you order and administer those. And second is utilization of the partnering pharmacy. That's great information for us to have as we're planning how to approach content going forward. Thank you so much. I don't run polls very often, so what do I do now? Oh, and we do have comments. So we've got a couple of, Charlie Gribben says they order and administer their own vaccines most of the time, but can't store them anymore. So they're strongly encouraging and partnering with the pharmacy and public health. It's hard to get employees to share when they got a vaccine now. Thanks. If they get it out in the community, I assume that's what you're talking about. Thank you for sharing that. All right. Okay, so we have some upcoming immunization information systems training sessions that are specific to Montana. And there's a link here in this slide to access those. Looks like they are Tuesday, June 14th from 8 to 9 Mountain Time and Thursday, the 16th from 12 to 1 Mountain Time. So if you're interested in accessing the MTRACs or need some additional information on that, you can click those links. Next slide, please. Okay, so I'm going to give kind of a really high level overview of kind of global COVID vaccine statistics, both in our region and across the nation. And Kelly's going to do a bit of a deeper dive into that. So next slide, please. Okay, so from our CMS nursing home data, this is what our region is looking like. So again, I'm sure you all are well aware that we cover Montana, Wyoming, Alaska, and Hawaii. So we've got Alaska's rates in blue, Hawaii's in orange, Montana is that gray color. Our Pacific territories are the gold, and Wyoming is in green. So our baseline, we utilized a baseline rate of September 2021, last September, and then comparing the first 5 months of the year. And I think, our states have done fairly well overall. I know a couple of them are a little slow getting going, but it looks like our resident booster rates across the board now are looking pretty good. And of course, they fluctuate from month to month based on if some of you are more transitional care and you've got lots of admissions and discharges. I know that affects your rates from week to week, even month to month. But this is kind of what we're looking like for our 4 states, which I think is fantastic. Next slide, please. Okay, and then by state, this is the percent of our total population. So this is the previous was the residents in our homes, and this is our total population fully vaccinated by state. And so we can pick out, let's see, we've got Wyoming lagging a little bit behind. I think Montana is in our kind of that last 25% or so. Alaska sitting right at the middle, which is where I live, and we were high up there for a while. And I think, at least for my state, I can't speak to any, I think that folks are just kind of tired of getting poked. And we had some struggles getting them to begin with, and now to continue to get boosters, we have to really continue hammering that education home. And then Hawaii has been our golden child throughout, and they're up there in that top quarter. Next slide. And then here's our percent of fully vaccinated with the first booster dose. Of course, they changed the definition of up to date. So that was the initial series on the previous slide. And here's our first booster. So of those who are fully vaccinated, who's gotten their first booster? And we've got Alaska now here up at the top. So the folks who have been vaccinated are willing to get the booster. Hawaii's still up there. Montana is doing great for those who have gotten vaccinated, and Wyoming's kind of right there in the middle. So the ones who are being vaccinated seem fairly willing, about half of them anyway, compared to the rest of the states, to get that first booster. But it seems like for some, we still need to get the initial series in many of our states. So having said all that and taking a look at where we land, I'm going to hand it over to Kelly O'Leary, who's going to do a bit of a deeper dive, especially with long-term care and healthcare specific. So Kelly is a registered nurse. She's got a master's degree in community health nursing, and she's certified in infection control. She spent 20 years being an infection preventionist, lots of it in acute care here in Alaska. She's also taught nursing at Hawaii Community College. But her full-time position currently is the infection preventionist at the Hawaii State Department of Health, and she provides guidance and support to the skilled nursing facilities. And I hear all kinds of fantastic feedback about her when I talk to them. And she also consults here with Alaska. So she, kind of like me, straddles the best of all possible worlds. We rep 49 and 50. So I'm really happy to have you here, Kelly. She's always been great at supporting us in the home. So I'll let you take it away.
Right. Hi, everybody. You guys can hear me okay, yeah? Okay, I see Dana's nod. So it was interesting. You can go to the next slide. As I was challenged with this question from Dana's, why is Hawaii so much higher? And so it was good for me to take a little bit more of a deep dive, other than, we talk it up a lot. And there's this kind of feeling of cultural ohana. So I kind of tried to pull in some information, taking that 360 look of why does Hawaii have a higher vaccination rate. So just to start off here, so Healthcare Association of Hawaii It's HAH, but they put out a survey February of 2021, and that was to the administrators of our long-term care facilities. And this is around Delta, right as Delta was peaking and then coming down, and we also had vaccinations available too. So this was a survey going out to all the long-term care administrators, trying to find out what strategies they were using to get folks vaccinated. And so these are just the bullet points. The frequent communications are just written, text messages, verbal, one-on-ones, virtual network meetings, question and answer sessions. And then engaging the leaders to vaccinate first, showing that leading by example. Frequent education and sharing of resources, so making sure that the resources were from reputable folks, CDC and Hawaii Department of Health. Those were the top places where folks get most of their information. And then engaging through cultural leadership, I think that ended up being pretty key. And so that was speaking to culturally or racially diverse groups, so Pacific Islanders, Filipinos. And then Q&A with public health leaders and long-term care, medical leadership. Always have to have some sort of staff recognition, drawings and raffles. So some of this looks a little like what folks might do around influenza campaign. So in looking at this, I thought, okay, this is good information. Let's, see how it did. And of course, we were high in our vaccination percent and made our public health director very happy. And so as you can see where Dana had said we were the golden child in the fully vaccinated graph, when you looked at the booster graph, we weren't so much the golden child, we were dropped down. So that's where our public health director said, why were we doing so good with fully vaccinated in our long-term care facilities? And then we're not doing as well with the boost. So in this presentation, I'll show that we have just actually gotten, this is hot off the press, a survey out to 2 long-term care facilities asking that question. So this initial survey was around Delta and it was to long-term care administrators. So go ahead, next slide. So as I was trying to scratch my head and figure out why is Hawaii higher in the vaccination, I pulled this this data, which was updated May 15th of this year from USA Facts, and it's COVID vaccine tracker. So I just found it interesting, and you can see the blue is the fully vaccinated, that the higher cultural group was Native Hawaiians, Pacific Islanders, and Asian. American Indian, Alaska Native also looks like they're tied. So, in thinking about the folks that we have living here are residents, not necessarily residents, long-term care residents, folks that live in Hawaii. We have a lot of the Native Hawaiian, Pacific Islanders, and Asian. So that was kind of my initial, things that make me go, maybe that's part of why we have a higher vaccine uptake. Go ahead, next slide. So these next two graphs are around staff vaccination, and that's kind of where we're hoping to increase. We're doing really well with the residents, but it's the staff that we're trying to get the booster rate. So you can see here's the regular fully vaccinated graph, and looking at the top 10. And I want to find out what Guam and Puerto Rico are doing. But anyway, I can get back to you, Dana, on that. But they're kind of high in all these graphs, which also makes me think, and I'm going to pull this all together, that we're on an island, in the middle of nowhere. And so there's that kind of protective mechanism, I think, or that instinct to protect. So anyway, this is the fully vaccinated amongst staff. This is the NHSN data. And so Hawaii, you can kind of see Alaska, I think, is pretty upward. There's Alaska in the middle. Okay. yeah, so you can find your state and see where you're at. And it's also good to know that your work that you're doing, putting in NHSN data, we do look at it and try to analyze. So go ahead and go to the next slide. And this is the booster dose. So the percent of staff getting their first booster. And so you can see the top 10 states, and it just kind of goes down from there. Go ahead, next slide. And then these next few slides are the vaccine requirements, because I was also trying to look at those top 10 states and what makes them different, you know, including Hawaii. And so here is the national graph for state employee vaccination requirements. And you can see the blue versus yellow, those that have to have vaccine requirement versus a vaccine or test. And so Hawaii does fall into that vaccine or test for state employees. And then this is where, you know, I began to kind of veer off a little bit, like, well, how many state employees does Hawaii have? Because I know a lot of our hospitals and long-term care facilities are run by our state. So that was also something that I kind of will pull into here, but you can see the state mandated vaccine requirements. And the next slide. This is the healthcare worker vaccine requirement by state. Now, most fall under the CMS that, you know, you have to have, you're fully vaccinated, but you can see by state who actually has that mandate, and Hawaii is not in that mandate. And again, I wondered why, but my answer was, most of our healthcare workers do work in a state-run facility. The other big kahuna we have here is Kaiser for healthcare. Next slide. This is just a picture of by island. The only island we don't have a state-run facility is in Maui, and that recently just got taken over by Kaiser. So you can see that a lot of our healthcare workers would be vaccinated or mandated to be vaccinated under that state requirement, and then as well as CMS. Next slide. So our director, our public health director, challenged us to go find out why staff in long-term cares aren't getting their booster. We're doing so well, fully vaccinated, but why not booster? So I'm acknowledging the team here that pulled this together, and they developed a survey, and we've just recently got some data back, and it's 2 long-term care facilities in Kauai. This was a pilot survey, and we are about to actually launch this to all of our long-term care facilities in our state to gather additional information. Go ahead, next slide. So this was done actually, what are we in June? This is May 2022 that they did this survey. And there were 97 respondents. And interestingly enough, when you look at the race categories, Filipino, white, Japanese, Native Hawaiians were the folks that not only filled the survey out, but you can tell that that's the population that we had in our long-term care facility. If you remember that first graph that I showed you, those that had the higher vaccination rate. Next slide. So I just pulled out some of the really, I think, more pertinent results from their survey. And so when I mentioned that idea of, you know, cultural and ohana, you know, we have about, in some households, there could be 4 generations living in a household. So there's that ohana and that feeling of taking care of your elderly. And the Hawaiian word for elderly is kapuna. So we were interested to know, you know, again, why folks didn't get vaccinated, but then why did they get vaccinated? So here, finding out that, you know, they have more than one person living in their house. There's 2 to 4 persons, and then 43% had an elderly person, 65 or older, living in their household. So wondering if this was having them, was encouraging them to get vaccinated just because they wanted to protect their kapuna. So we have lots of multi-generational living situations here in Hawaii. Go ahead, next slide. So this slide is the finding out the primary reason for receiving the COVID-19 vaccine. And I'll make mention that while we had 97 respondents, only 1 that responded didn't get the vaccine. So I think for the benefit of their pilot study, we weren't really targeting the population that we wanted to get to, was why aren't you getting vaccinated? But I think it gave us some information to do a presentation like this, is why did people get vaccinated and boosted? So the primary reason for getting vaccinated, this is fully vaccinated, is that, benefits outweigh the risks or the side effects, and it's strongly encouraged by my employer. Other reasons were mostly to protect others, including residents, coworkers, family, friends. They were traveling. Didn't want to deal with the social political hassles of not getting it. Go ahead, next slide. And then these were reasons why they didn't get the booster. So that was why they got vaccinated, but now you got vaccinated, why didn't you get the booster? 44% didn't believe it was necessary. So we're in interesting times right now, I think, with the Omicron variant, which folks see may not be as much of a risk as the prior variants. We do hear that the vaccine may not be as protective, and I'll make mention in a couple slides. And then they see folks getting COVID when they've been vaccinated. So then there's that, why bother? So actually, I can make mention now. There was a MMWR that came out May 6th, and it's looking at vaccine effectiveness regarding the Omicron variant, and the time frame was February 14th through March 27th of this year. So it was looking at that, and this was particularly for nursing homes, that having that additional dose or booster actually had a vaccine effectiveness of 46.9% or 47%. So they are getting some vaccine effectiveness. Even though Omicron is evading the vaccine, it is still preventing cases, but the main thing is really that it's keeping folks out of the hospital and keeping them from dying. So, of course, we have to circle back to that, keeping you out of the hospital and keeping you from dying. So the Omicron, the study was 46.9% effectiveness, and then comparing to Delta variant, it was 50 to 58% effective. So not too much different, but I think the main point is the vaccine's doing its job when we see that cases are down and hospitalizations are also down. This study was not looking at time. So when we think about when folks got their booster and then when they did this study, that there may have been like a 3 to 4 month lag. So there is that, idea that this study reflects the decline in vaccine effectiveness because of that immune evasion of the Omicron variant in the time. Go ahead, next slide. Other reasons for not receiving the booster among the non-boosted but vaccinated is that it wasn't mandatory. So I thought that was kind of interesting too, how that really does provide a level of importance, I guess, is making it mandatory. Go ahead and next slide. And then for those primary reason for receiving the booster dose, it was that they did believe that it offered additional protection. So I just gave you an MMWR to be able to take maybe some talking points for those staff that maybe still are on the fence. And then it's strongly encouraged by my employer, which I'm certain that you guys are still encouraging. Go ahead, next slide. And then vaccinated but not boosted, why they believed it wasn't necessary. And here are all those things that I just mentioned. They felt like they had natural immunity. The booster dose is unlikely to be effective against new variants. And actually disregard that third one, because they do believe it's, well, don't disregard it. They do believe it's necessary, but they hadn't got it yet. So that's the other thing. I think people are waiting to get that booster. I know for myself, I'm waiting to get my booster. I'm eligible, but I'm going to be traveling here in July. And so I wanted to be able to have my booster on board to protect me at maybe my most high risk activity. However, it has me pausing because right now, Alaska, I don't know, we had like 8,000 cases or something yesterday. And we know that we want to times that by 5, and that's probably the real number of cases we're having in our state. So I'm feeling like it's time to get my booster. Go ahead, next slide. And so we left it open for the respondents to just add in some information about what they feel like folks could do. And so more education around the benefits of getting the vaccine, recognizing and rewarding. So maybe if there's some, you know, pizza dollars or some competition, or I know we can all be some creative. Of course, there's always that mandatory, and this is not me saying this, this is what folks from the survey had said, although I do believe that that does help. Lunch credits or other incentives were also suggested. Go ahead, next slide. And so just to try to summarize this, from looking at all of this data, was maybe it is that we are isolated on an island where there is this instinct to protect and control. So it was maybe there's a little post-traumatic from the Captain Cook days when, you know, a lot of Hawaiians were taken out by those sexually transmitted diseases. So maybe there's a little of that. But when I look at the data for Guam and Puerto Rico, maybe there is something to that. I know that in the beginning it was, you know, a lot of Hawaiians were saying, you know, keep people out, which was why I think we had such a tough travel policy. This idea of cultural, so we do have that higher race that is highly vaccinated living in our state, and then that ohana, that sense of family. Education provided to targeted groups. You know, I think that some folks were going into churches and trying to get those culturally, maybe, you know, we had to find a priest or somebody that they would trust to be able to pass on some of this information. The mandates, and then accessibility is really key. And I know in some of your states pretty rural. So I just use, we have adult residential care homes, or, you know, they could be called assisted living homes, but it's those kind of mom and pop, you know, the family run assisted living facility that have just a few rooms available. It was hard for them to get their residents out to get vaccinated. So we had a group that looked at those higher risk areas, and we had folks go to their homes and vaccinate their residents. And then Department of Health and other community partners, you know, had these pop-up tents and just tried to get the vaccine out there, which again, I know a lot of facilities have done, or a lot of states have done. You know, it is interesting to look into the future. There is a vaccine uptake more with surges of the variants. So we're kind of in this middle of Omicron B2 variant. And I think the challenge is just to keep that momentum into why we have to get vaccinated. And I know that vaccine dispersion is moving towards providers and getting it in your, you know, with your doctor or at the pharmacy, kind of like we do with flu. So I think while we put so much emphasis on pop-ups and trying to get vaccine to people, that's going to be happening less, where people have to go get the vaccine. So I think we're going to be challenged for a variety of reasons, trying to get folks boosted. I think that that's the end of my presentation. Any questions? So it's just ongoing We're going to spread that survey out to the rest of our long-term care facilities so I can provide an update.
That's
Maybe
exciting.
another
That would
time.
be great. That's great information, Kelly. Does anybody have any questions or comments? I think one thing that you touched on that spoke to me that I don't know that we've necessarily used as much as we could have. Of course, I'm looking at, the nursing home population, not necessarily the whole state, is the community leader providing the information and the support for getting vaccinated through the community leaders. You mentioned like a priest. And I think, as we dive more into equity and inclusion, I think we'll be really called upon to use those leaders that are right there in the communities of the people we're trying to get as partners for that kind of thing. I think that really struck me.
Comes down to trust, right?
Yeah, right.
Well, thank you for allowing me to talk about that.
Thank you so much. I always enjoy it when you present for us. So we have put a evaluation link in the chat. If you would click on that and complete it for us. I think it only takes a couple of seconds. And again, I just want to reiterate that if you have things that you think we might be able to shed some light on, topics we could cover later, please throw that in the chat as well, or message one of us at any time. We're always here for you. Thank you.